Greetings from Indian Journal of Anaesthesia. I, Dr. Reniki Sharma, will be presenting an article published in the June 2024 issue of Indian Journal of Anaesthesia titled Comparison of the Efficacy of 0.9% normal saline with balanced crystalloid, that is Plasmalyte, in maintaining the metabolic profile in head injury patients undergoing evacuation of acute subdural haematoma, a randomized controlled trial. Large volume normal saline infusion in traumatic brain injury patients is associated with hyperchloremic metabolic acidosis and acute kidney injury. Plasmalyte is an isotonic balanced crystalloid, offers a more physiological metabolic profile compared to normal saline and does not exacerbate cerebral edema. Serum creatinine alone may not suffice to diagnose acute kidney injury postoperatively. So early use of biomarkers such as NGAL, interleukin-18, kidney injury molecule 1, tissue inhibitor of metalloproteinases 2, and insulin-like growth factor binding protein 7 are useful. This study aims to compare normal saline and Plasmalyte in patients undergoing craniotomy and evacuation of acute subdural hematoma in terms of metabolic profile, brain relaxation, coagulation profile, and risk of acute kidney injury in the perioperative period. So the primary objective of this study was to compare the metabolic profile in terms of pH, PCO2, bicarbonate, chloride, base excess, and anion gap between the two groups. The secondary objectives were brain relaxation scores, renal function test, plasma osmolality, coagulation profile, and urinary biomarkers, that is tissue inhibitor of metalloproteinases 2 and insulin-like growth factor binding protein 7 in between these two groups. So institutional ethical committee approval was taken and the trial was registered in Clinical Trials Registry of India. It was a randomized controlled trial that included patients 18 to 60 years of age scheduled for craniotomy and evacuation of acute subdural hematoma. This study excluded patients with simultaneous thoracic abdominal injuries or long bone fractures, pre-existing renal failure with a serum creatinine of more than 2 mg per deciliter, dyselectrolytemia, hepatic failure, altered coagulation status, and pregnant patients were also excluded from the study. After recruitment, the patients were randomized by computer-generated random sequence number table with sequentially numbered opaque sealed envelope for allocation concealment. There were two groups, the group normal saline, that is the group NS, and group P. After pre-oxygenation with 100% oxygen, patients were induced with fentanyl, thiopentone, and rocuronium, followed by endotracheal intubation. Then right subclavian vein was cannulated and radial artery was cannulated. Maintenance fluid, according to the group allocated, was started at 2 ml per kg per hour, titrated to hemodynamics. So the NS group received 0.9% normal saline and group P received Plasmalyte as maintenance fluid. IV mannitol 1 gram per kg was given before opening of the dura mater. The brain relaxation scores were assessed by the surgeon operating after they opened the dura from a score of 1, which was perfectly relaxed, to 4, that is a bulging brain. Baseline ABG was noted and repeated every 2 hours till the end of surgery and in postoperative day 1. Urine samples were collected at the start of surgery, 1 hour postoperatively, and on postoperative day 1. Urinary biomarkers were measured with ELISA, that is tissue inhibitor of metalloproteinases 2 into insulin-like growth factor binding protein 7. It was calculated in nanogram per ml meter square by 1000. The hemodynamics were recorded at induction and at 10-minute interval intraoperatively. If there was hypotension, it was managed by fluid boluses and IV mephentermine 3 mg. Intraoperative blood loss, total fluids, and blood transfusions received were noted. Complete hemogram renal function tests were repeated on postoperative day 1 and on day 5. So the primary outcome was pH, base excess, and chloride measured at specified time points perioperatively. The secondary outcomes were brain relaxation scores, coagulation profile, renal function test, plasma osmolarity, and urinary biomarker in between the two groups. The sample size was based on a previous study. By comparing two independent means and considering a minimum expected difference in pH between the two groups as 0.0315 with standard deviation of 0.05, at 5% level of significance and 80% power, 90 patients were required. So a total of 45 patients were the sample size per group. SPSS version 19 was used for statistical analysis. The numerical data were expressed as mean and standard deviation, categorical data in percentages. The parametric variables were compared using unpaired t-test. The difference in metabolic parameters analyzed using two-way repeated measure of ANOVA after analyzing baseline values. Brain relaxation scores were analyzed using Mann-Whitney U-test, and a p-value less than 0.05 was considered significant. So in results, there were 45 patients were analyzed per group. We can see that the baseline demographic characters between group P and group NS did not differ significantly. They were similar. In this table, comparing the metabolic parameters, we can see that pH at various time points, bicarbonate at various time points, and base excess at various time points, there was a significant difference between these two groups in these metabolic parameters. The pH was significantly lower in the group NS. Bicarb was significantly lower in group NS. Similarly, base excess was lower in the group NS. Again, while comparison of electrolytes, sodium and chloride and plasma osmolality, it is found that sodium and chloride were significantly lower between the two groups, were significantly lower in the Plasmalyte group. But the plasma osmolality did not differ significantly between the two groups. The brain relaxation score also did not differ significantly between the two groups. While comparison of renal parameters and urinary biomarkers, we can see that urea, creatinine, and urinary biomarker tissue inhibitor of metalloproteinase 2 into insulin-like growth factor binding protein 7 were differed significantly between the two groups. The urea and creatinine were significantly lower on postoperative day 1 and day 5 in Plasmalyte group. However, in both these groups, the urea and creatinine levels were in the normal range. So the Plasmalyte demonstrated superiority over 0.9% normal saline in maintaining the metabolic profile of patients without adversely impacting brain relaxation. Fluid management in traumatic brain injury patients has been controversial due to relation between cerebral edema and osmolality of fluid. Mildly hyperosmolar fluids like normal saline have been associated with adverse outcomes. Large RCTs have demonstrated motility benefit with balanced crystalloids, that is Plasmalyte. Trials have also found that normal saline is associated with higher incidence of major adverse kidney events like acute kidney injury. Urinary biomarkers that has been used in this study, such as tissue inhibitor of metalloproteinases 2 into insulin-like growth factor binding protein 7, detects acute kidney injury earlier than serum creatinine. Although no patient developed AKI in this study, previous trials have found that balanced crystalloids are better than normal saline in this aspect. Intraoperative brain relaxation during craniotomies is influenced by IV fluid osmolality with no significant difference observed between normal saline and balanced crystalloids in maintaining brain relaxation. Also, despite 32 to 35% prevalence of coagulopathy in traumatic brain injury patients, coagulation profile were similar between the two groups in this study. Limitations of this study include the use of PT-INR instead of viscohemostatic assays for assessing the coagulation and financial constraints, limiting repeated testing of urinary biomarkers. So from this study, it can be concluded that Plasmalyte exhibits a superior metabolic profile compared to normal saline in patients undergoing emergency craniotomy for subdural hematoma evacuation while maintaining adequate brain relaxation. The coagulation profile remains similar between these patients receiving either Plasmalyte or normal saline. Although none of the patients developed acute kidney injury, patients who received Plasmalyte showed significantly lower levels of serum creatinine and urinary biomarkers. Thank you.